It's very great privilege to be here, and it's also a great privilege to swing things a little bit away from clinical medicine to looking after ourselves. And I know that Lawrence and I have got a good afternoon planned for you to talk predominantly about mindfulness, which I hope some of you have heard a little bit about. I hope some of you even practice. But for those of you who are exploring it, that you'll get a nice eye-opening to what mindfulness actually is and how it can help us. So, as Monash said, I'm a doctor, I'm an intensivist, and I work at Frankston in Melbourne. I just want to list these other organisations that I work for. I'm also an academic researcher, but more recently I've started working with Baxter Healthcare, who is a healthcare company that you'll be familiar with. And then more recently I've begun a venture into wellness in terms of a company we call the New Normal Project, and we've started to organise events. So I don't really know who I'm representing today, but I want to talk about our brains being the centre of our health and well-being as well as I can. I think it's not news to any of us in this room that our lives are very busy. It's a stressful world with us spending a lot of time thinking, with us doing a lot of things, and with people running past us all the time. And for us in critical care, where we have to deal with these difficult patients, that makes it even harder. We also have to deal very commonly with the relationships we have to build and pursue in creating good clinical environments, which are challenging. And of course, our lives are so much more than our careers, and so there's so much else for us to take into our brains on a daily basis so that we can keep living harmoniously. And of course, in our world, our generation, we kind of invented the delusion of multitasking, which we're told is the way to deal with all this, but is clearly not. For those of you who read and think about this, multitasking is not possible at all. We can do a very simple task while we're doing a moderately complex task, like driving and listening to the radio, but to try and do two complicated, complex tasks is been scientifically shown not to be possible. Our brains can switch very easily, but we have to switch back. And the cost in time and also willpower and mental sort of effort is difficult. And so we can switch, but we cannot seriously do multitasking, unless you're a woman. No, sorry, just a joke. Now, we've also had the sort of luxury, I suppose, and the difficulty, combined luxury and difficulty of having a smartphone, which on one hand is truly a fantastic productivity and connecting tool with others, but on the other hand can be a socially isolating and stress-inducing hand grenade, literally. And so we struggle in our generation with how to deal with this phenomenon. Let alone this phenomenon that's come along, and I know that many of us have probably played with our phones at various times during these lectures, including me, I'll apologise, looking at our social media feeds, which can be very beneficial to keep us connected with the world and what's going on, but already scientists are starting to show the detriment that this can have to our productivity and our ability to do our jobs very well. All of which means our brains are sometimes a bit of a mess. And sometimes we feel, perhaps not even sometimes, a lot of the time, we feel a bit like this. And of course, the more we feel like this, the more we seriously feel the stress. And I think we're all familiar with those feelings, those symptoms we can sometimes get, where we get the palpitations or just the thumping of the heart. Palpitations suggest an arrhythmia, but what I mean is that thumping of the heart. Or maybe we can feel the knot in the stomach or the sweat on the brow or whatever the symptom is. We might just subtly notice it. But often we don't even notice the symptoms at all. And therefore, this can become a big problem that we don't even realise is a problem. Of course, stress is important. And dealing with this sort of guy when you meet a saber-toothed tiger in evolution was really important, that the human body learned how to work and deal with it with a fight or flight response. And I hope most of us would have flown away from this guy, but we need to have a system that deals with it. And in our era, we've now really understood this stress response at a microphysiological level, particularly in critical care, where we talk about all these cytokines. And I don't want to mention one name off this thing other than to say that it is complicated, but we can't be switched on in stress all the time. And our lives are starting to become, particularly in heavy healthcare work, that we are stressed. We're thinking all the time that we've got a saber-toothed tiger just beside us. And whether that's just your emails or your social media or the patient or the patient's family that's waiting to talk to you, whatever it is, they're just coming at us all the time. And this is really bad for us, our health, and particularly our brain health. Now, I don't want you to think that stress is all bad, because there's clearly a relationship between our ability to perform as a human being and stress. So much so that, if we are, in fact, I'll change the graph to put a bit of colour to it. And we want to really operate in this yellow zone most of the time, where this is our performance and this is the level of stress. And so we're kind of at a medium level of stress, excuse me, that allows us to perform pretty well. And over, depending on how much the stress is raised in that level, we can get a bit better performance out of us. But eventually we're going to fatigue, and that's fine. We'll go home and have a night off, or we're going to have a weekend off, or an annual leave period, and we can come back down that slope and feel a bit better. If we're down here, we don't get anything done, and we're not going to be really good unless there's some level of stress to help us perform. But here's where it gets to be in trouble, and a lot of us regularly come into this sort of exhaustion phase and suddenly need those weekends off, or need that period of good annual leave to kind of bring us back to the optimal performance level. And of course, we all know of people, and perhaps some of us have had it, where we start to get into the phase where our performance drops off and we start to become anxious and even towards the level of breakdown or burnout. And so this is really important, and I wanted to just point out what I've got on this slide is that I've got performance on this scale, but I think we can have some other things. I think our health and well-being requires a bit of stress too. We've got to push ourselves, whether it's just going for a run or eating well or whatever. We need the stress of that to get our best health and well-being as well. And I think it also gives us fulfillment to be a bit stressed in our lives too. So I don't want it all to be about stress being bad, but understand that stress is something we need to know about and manage as best we can. Now, I know we're not all intensivists in here, but I understand from Monash that most people are working in critical care. So this is a study done in Australia and New Zealand from intensive care. Intensivists, and I was actually a participant in this study. This is Yahya Shahabi, led a group of researchers who did a survey using a very well-validated tool for understanding stress levels of human beings in their jobs, and found that intensivists, 80% of us, showed signs of psychological stress and discomfort. Now that's okay. I just told you we need to feel a bit stressed, otherwise we're not going to perform well. But what was worrying is that many, 42% showed signs of emotional exhaustion, going over the curve. There were 32% with, around about a third with negative feelings and cynicism about their job, and 37% felt they underachieved in personal accomplishments. So around a third of people are showing the sort of bad signs of stress in their jobs. And this is back in 2008, I don't know if you can all see that, so nearly 10 years ago, and I would imagine that things have probably got worse. And remember that people tend to underreport what they really feel and what they really are. I completed this, and I would have told you I had no chance of being one of the people that was burned out, yet I'll tell you a little bit about my story in a moment. In America, this is all the different medical specialties. All of them have burnout rates above 30%. And look, intensive care and emergency medicine are right up there, two of the highest. And burnout in this case is defined as one of those three things that I said before. Loss of enthusiasm, feelings of cynicism, and low feeling of personal accomplishment. So this is common, and we've got to understand that in intensive care, I know I've just focusing on doctors with these data, but I think it's possibly even worse in nurses because of the shift work and the more night shifts and things that nursing staff do. So I think we've got to understand it's there. And the point is we can't totally eradicate stress, but we've got to minimise it and try to reduce it as best we can, particularly before we all build it up till we meet the straw that breaks the camel's back. And the reason I like the straw analogy is because this is how I felt a few years ago. Because about 4 years ago, I was doing a full-time intensive care clinical role. I was also doing a lot of academic work as a researcher down in Melbourne at the Monash University with ANZIC's clinical trials group and other people. And I was on all the committees at the hospital that you're expected to be. I was just finished being a deputy director and moved into a more official research role. But I let it get too much. And truthfully, a combination of being a yes man to pretty well everything for the previous decade had really got me in a spot of bother. I'd said yes to every research study that anybody asked me to be involved with. I'd said yes to any talk anyone ever asked me to give, particularly if it was overseas. I said yes to any committee to be on. I said yes if they wanted me to be the chair of the committee. I just kept saying yes because that's what you do, you achieve. You just accomplish. And sometimes in retrospect I feel like what I did is I got on a treadmill at kindergarten, which went from kindergarten to primary school to secondary school to medical school to specialist training to associate professor to nearly professor. And I think many of us are on this treadmill and we don't even realise it. And maybe I was one of the ones that was more likely to be ambitious than some, but what it really all came down to was that one day it all just spun out of control. Something happened at work. I don't want to go into all the details right now, but what happened was that I had to suddenly face that I couldn't work right there. And I left my hospital, the Alfred where I was working, and had a period without work. And this was a trying period where I realised that I had to rebuild my life after having become a yes man and built up the roles and responsibilities so much that I couldn't cope anymore. And so I realised quite quickly, it wasn't hard when you're sitting on your bottom with nothing else to do, than to think that whenever I'd been saying yes to these things, what really I was doing was saying no to so much more. I was saying no to spending time with my wife and my kids. I was saying no to having a regular exercise routine. I'd gone from running marathons to sitting on a chair for most of the time. I was saying no to having friends in my life. I was saying no to having regular hobbies. I was saying no to all the things that, I was saying no to having good sleep. I'd never heard of mindfulness. And so when you put all this together, I don't think I was doing everything the right way. And having realised that, I've tried to put together a bit of a solution for myself. And one of the tools has been mindfulness, which I'm going to talk about. I started with asking the question, how can I build a better life? My best thinking and all that schooling and that progression on that treadmill had got me sitting on my bottom outside my job. And I had to think, how can I really build a different life that was going to work? And I guess better life, I tried to think of the right word. Is it fulfilling? I don't know what we're really here for, but using fulfilling as a word gives me a sense of purpose about our lives and my life. And in trying to rebuild it, I've really spent a lot of time thinking about this over the last 4 years. And so what I've kind of boiled it down to into something I want to summarise briefly is that a fulfilling life has three main components. The first of which is that we have to nurture ourselves. Pretty obvious, but we've got to spend a fair bit of time nurturing ourselves without caring about other people while we're doing it. Seriously, selfish behaviour to help us help others. We've also got to really belong in the communities that we're involved with, be they our family, our work colleagues, our community, our medical communities that we engage with, our friends, our footy community, or whatever the sporting community you're in or whatever. We need to really belong. And why I say belong is there has to be a mutual respect from each side. We have to really want to be part of that community and they really want to have us in it. And I think unless we build that relationship with people, we're not going to ever be able to do that. And finally, we've got to contribute to humanity. Now, fortunately, in intensive care, we have the privilege of looking after the sickest people in our healthcare system, and that is a big contribution to humanity. But I think sometimes we've got to be careful we're making the best contribution we can for our particular makeup, whoever we are. And so the point of it is that these three things are really, really important. And I now call it the fulfillment funnel, that if we balance all these three things well, we're going to lead to a life that is much more fulfilling. And of course, I think that also helps us with patient outcomes. If we can do all those things well, we're going to bring the best self we can with the best people and deliver the best contribution to humanity, which is hopefully patient outcomes will improve. So I'm not going to spend any time talking about these other contributions than what I've said, but nurturing ourselves is just so important. And for me now, I've made it really about sustaining my body with exercise and diet predominantly, refreshing with good sleep and getting rest and holidays and sabbaticals, whatever you need to refresh yourselves. But lastly, looking within, which is really what we're going to concentrate for the rest of the conversation on. So looking within, to me, is just really deep reflection that includes a component of mindfulness, which is what I want to talk about for the moment, for the rest. And so mindfulness, let's just start with what that actually means, because sometimes people have thought, well, what does that really mean? And for me, I just like the idea that it's like the flagpole, for that flag, which is just flapping galore in the wind, and the mindfulness keeps us centered as best we can. There is a good definition that I like to use, which comes from John Kabat-Zinn, who's a doctor who put together a mindfulness-based stress reduction program that's been running for 45 years now throughout the world. I've done one of his courses. So he's a doctor who really brought mindfulness to healthcare, really. And his definition is, as you see there, mindfulness is the awareness that arises from paying attention on purpose, in the present moment, non-judgmentally. Now, that might sound like what you think you do anyway, but let me just tell you what I think not being mindful is. And here are some examples. Being lost in thought. How often are we thinking 100 miles away? People even in this room are probably thinking things that I'm not saying, which is understandable. How often are we distracted by the phone or by the person beside us or whatever it is? How often are we being overwhelmed by the difficult emotions, still stressed from what happened yesterday, or still worried about what is going to happen 5 days from now? Thoughts mainly about the past and the future too. This is the unmindful or the not being mindful approach. That's obvious. None of this is rocket science, but we really need to understand this as well as we can. Excuse me. Some people might call it mindlessness rather than not being mindful. And let me just give you a couple of examples. Have you ever experienced a mindless greeting from someone or a mindless service in the bank or something? I think we can all remember many times where that hug with the person you just greeted was so, not right, and it just didn't feel mindful. Or you gave one, or you gave a peck on the cheek that wasn't really genuine. And I think we see that all the time. Have you ever spoken to someone who really doesn't seem to be there? They're not listening to you. They're not physically, they might be physically present, but emotionally and mentally they're not there. It happens all the time to me, so I'm sure it does to you too. And how often have you gone through the motions yourself when you're listening to someone? Just, yes, okay, but you're thinking about that thing that's going on. And look, this is common human behaviour. This is the human being. We do this. And so it's about, understanding that that's what we're going to try and do. Lack of awareness is another term for this, unmindfulness. And really, this is another way of putting it, that we see what is not there. We don't see what is there. We choose to hear, or we hear what we choose to listen to. And we really don't hear what we don't attend to with our mindfulness. And so I hope I've made it obvious what the difference between mindfulness and lack of mindfulness is. Really what it's about is trying to develop a process and a system for bringing yourself to become more mindful. Sort of like attention training, really understanding and training the mind to be as attentive as it can to, as an example, watching this drip actually hit the water. And there are many mindfulness practices. Here's a list of them, some of them, there's probably more than this. And of course, we're talking about meditation or mindfulness exercises today, but all these other things that some of you probably do regularly in your lives are forms of mindfulness. So it doesn't mean, I don't mean today that you have to sit and meditate, which is a lot of people think mindfulness is. I I understand now that meditation is something you can do sitting anywhere, in any chair, and just close your eyes and do it. In the past, when I was a younger boy, my uncle was part of an ashram, an Indian ashram, who did meditation, and they used to come to my house, our house, family's house, and his wife and he would chant and burn incense and sort of do this, get into this interesting attire for me as a young boy. And so that spooked me a bit, that was the meditation that he did. But now I realise that you don't need all that. You just need to sit in a chair. We can do it today. Hopefully Lawrence is going to take us through a practice today. It's a bit like being this mountain and watching what goes around you. Watching what grows on you, the grass and the trees. Watch what animals come and go on you. Watch the seasons going past. Just watch light and day. Watch your reflection in that water. You can think of so many things that mountain could be doing. The other important part about mindfulness is that the mountain doesn't move. It just sits there like a rock. It is a rock. And so this is really, really what I like to think is a good analogy for what we're trying to do with mindfulness. Be that mountain. Or even better still, take the picture on the left and turn it into the picture on the right. They're the same picture, but one's just got so much more detail because we take so much more time to be mindful, to understand what's really there in the present now. I want to briefly take you through some science, because this is a scientific meeting and I don't really think it needs a lot of science to back it up, but there is a growing amount of peer-reviewed literature now showing the benefits of meditation, particularly mindfulness, on neuroscience and other parts of human behaviour. Neuroscience, for example, using the mindfulness-based stress reduction program that I mentioned before, John Kabat-Zinn put together, and I've had the fortune of doing it. It's just a 10-week course where you do 3 hours a week of come together with a group, and then you go and you practice daily. This sort of strategy for 10 weeks or 8 to 10 weeks can lead to really important brain imaging changes. You can see thinning of the amygdala, which is the emotional part of our brain, the reptile part of the reptilian version of the brain. And this is where we can, by thinning of the amygdala, it's like reducing emotional reactivity, which is what mindfulness can bring. Reduced emotional reactivity, just what we'd love. It can thicken the areas of the brain that promote calmness and clarity, which sounds like a good idea. It thickens the areas that positively affect gene expression for the rest of the body. So the brain's talking to the rest of the body and making your body be more healthy. That's got to be good. And it also creates new neural pathways inside the brain that can be imaged and seen within 8 to 10 weeks of doing this sort of thing. So it's really important. The other thing that this isn't in the brain, but the telomeres, which are the end of the chromosomes in our bodies, in our cells all around the body, they lengthen with good meditation. And this has been shown to be effectively the same as an anti-aging effect. So you don't need to go to the cosmetic physician, you just need to meditate. Here's a study showing that the longer that someone mindful meditates, the number of hours that people do it, the less emotional reactivity they've found in their amygdala. Now this is many thousands of hours of meditation. Monks who've been studied and shown that they can get much less emotional reactivity. But even we can start to get those effects at small periods of time into doing this sort of practice. This mindfulness-based stress reduction program I mentioned, here's some data from 100 people that went through this course, and they were all patients actually that turned up, outpatients who turned up to a hospital where they were running this program. And you can see that all these patients, before and after, it's not a randomised study, but it's before and after, how they rated themselves on the SF-36, which is a well validated and respected tool for looking at our human functions. And they showed that their physical skills, physical functioning improved, that role physical improved, that bodily pain improved, that there was also general health was perceived to be better, vitality better, social functioning better, emotional role and mental health. All the things that people gauge themselves in a before and after. Perhaps you could argue that they would expect, with having gone through 10 weeks that they would be better, but they certainly were. So that's all the science I want to talk about. I just want to briefly finish by saying what mindfulness has brought to me is the feeling that I can be more living in the now, really enjoy the experience of being in this room you know, with this climate, with these people that I'm listening to, these people I'm sitting with. And I think that makes me take in so much more from a day like today. I can feel so much more gratitude about the world. Just understand that breathing air is just an amazing thing to be grateful for. I used to think that was, you know, I didn't even care about that before. But just as an example, being more clear about what truly matters, my purpose and, you know, the things that you're doing really is deepened that feeling from being a regular meditator. Clearly reduces stress, and that has for me, but also improves communication and relationships, both at work, out of work. And I've noticed that, and maybe I can't measure that on a scale, but I certainly feel that. But most importantly for us as healthcare practitioners, it improves our ability to empathise and be compassionate to our patients. It also helps particularly with emotional awareness, because that's what we really need to work in a good team, understand the emotions of the people that we are working with. You know, be able to interpret all those 9 faces that you can see in this picture, which are all different emotions. I don't want to ask you to name them all, but they're all different. And so we can be able to perceive these a lot better. Also helps us go down this sort of hierarchy of empathy. You know, basic empathy is just to say you feel for somebody when something happens to them. But there's another version that's more that you understand why they feel that way, which we call the cognitive sort of version of empathy. But then right at the bottom is the motivational sort of empathy, where you actually want to help the person because you understand and you feel for them. And so mindfulness helps you progress down to a deeper sense of and ability to empathise so that we can help patients. I think really, most of us are in teams, and often many of us are leaders in those teams. Even if it's just at a cardiac arrest, we're still leaders. And so these things are helped by practicing mindfulness, active listening, giving corrective feedback, being able to influence people, positive feedback, coaching, career counselling, the sort of things that we need to be good leaders. It also helps create a high-performance culture if we're all aware and thinking of these things. But lastly, mindfulness helps you to become aware of the capability, the capacity and the competence of your staff that you're working with. Now that's got to be a good thing. And so therefore I'm pretty sure this mindfulness is very valuable to us. The last real comment I'm going to make is this statement that Viktor Frankl wrote in his book, Man's Search for Meaning. Viktor was a Holocaust survivor from the Second World War. He was a psychiatrist before he went to the war, and he survived through that. And he wrote a very deep and inspiring book that I recommend you all have a read at some stage if you've got time. And he says this statement that's really valuable. Between stimulus and response, there is a space. And in that space lies our freedom and our power to choose our response. And in our response lies our growth and our happiness. I think the more we can see that space and feel it growing, the better we're going to be at doing everything in this world. I'm going to finish with a couple of slides before Lawrence comes on. I use an app. It's a bit ironic sometimes to be using my mobile phone that I've just bagged for meditation, but it actually is very helpful to be able to do it where I want, when I want. And there's an app called Headspace. Some of you probably heard of it, some probably use it. It's fantastic. You have to pay a bit of money. You can get 10 free episodes for free, but after that you have to pay about $60, $70 a year. I think it's well worth it. And there's a list of other apps as well that I've just mentioned in case anyone's interested in finding some tool like that. The secret sauce for me is doing meditation in the morning and trying to do it every morning, because I think it just prepares you for your day so much better when you do that. And so I hope that I've inspired you in this talk really to think about having some exposure to mindfulness if you haven't had it before. I think what it's done for me is it's reduced my stress, and I feel so much better. I've been able to go back to work and choose to do these other roles that now I find very inspiring. And it also helps me to lead that fulfilling life that I really hope I can now. And so I'm going to finish there, leave my email address if anyone wants to ask me questions or get any of those apps when you go home. But thanks very much for listening. We're going to now do a session together, or some more talk from Lawrence, but that's going to involve some practice. So thanks very much. I look forward to doing that.